It's a big finance thing.
Yeah.
I can print it off when I need it.
All this meeting to order. We have quorum in the room. All right. Are we working now? Brilliant. And there's members of the public are advised that our meetings are webcast live by the City of Hamilton and temporarily archived on the city's website. Other individuals and the media may also be audibly or visually recording this meeting. Madam Clerk, are there any changes to the agenda?
Yes, there are. There is an added general information item, 11.2, Ministry of Health and Long-Term Care Memorandum regarding amendments to the protocol under the Ontario Public Health Standards Institutional Facility Outbreak Prevention and Control Protocol 2015.
Thank you. So, can I have a motion on the agenda as amended? Moved by Pearson, Partridge. All in favor? Carried. Any declarations of interest? Hearing none. Approval of the minutes of May the 21st. Moved by Ferguson, seconded by Duval. All in favor? Carried. Any declarations of interest? Hearing none. Consent items 5.1 through 5.1a through 5.1g. Move them all. Okay. Moved by Collins, seconded by Ferguson. All in favor? Carried. Then we have a motion through. Got that. And there is then public hearings. We don't have any, so we were straight to Brent Rowett and a presentation on Pan Am 2015, Hamilton Public Health Services Update. Brent is looking very stylish today.
Thank you, Mr. Chair.
Want to give us your label or your brand just for the edification of our style mavens here? Yeah. Looking regal in royal blue. I'm stretching here, Brent.
Sure, go ahead. Yeah, you do this on a regular basis. Had my wife dress me this morning. So.
Yeah, I know. Yep.
Thanks.
Our compliments to you.
I'll let her know that. So while this is coming up, what we're going to be doing here through you, Mr. Chair, is talking about Pan Am. And this is going to be your last Board of Health update on this subject. And I'm going to take about 10 minutes, and I'd welcome any questions that you have, because we want to make sure that you have full knowledge before the games and that you rest peacefully as we approach the games. That's our goal, to make you feel very comfortable so that you can join in the celebrations, and it's going to be a great celebration at that. So just to recap a little bit about what the Pan Am Games are about for yourselves and anybody in the audience who has not yet heard about the Pan Am Games, so they know where to get the tickets and when to get the tickets. It's July 10th to the 26th. 10th is the start of the celebrations. We're expecting between 10,000 to 20,000 spectators for each one of the games. There's one ticket per day, and most days are 2 games later on in the afternoon. There's at the beginning and at the end. There's 4 days. There's cultural events called Kick It Up. So please Google City of Hamilton and cultural events. So there's lots of activity to participate, and we're expecting 3 different official languages during the games, and the demographics include spectators, athletes, and dignitaries that will be here. So in terms of our readiness, and this is the part that public health we're really good at in terms of consequent management, but so too across the city. We've built a strong foundations already in place. We have a city emergency plan, which you as Board of Health members and council members are part of. Connie Verhage is leading that up now as the city's emergency coordinator with the expert leadership of Chief Simons. We've been through many training exercises, both locally and provincially, including the province and locally with the health sector. And the Emergency Operations Center, you had the foresight, City Council, the previous City Council, to help us put together a state-of-the-art Emergency Operations Center up on the Stone Church facility, so that's all set and ready to go. And 24/7, the Emergency Operations Control Group, previously known as the Control Group, will be on standby. Public Health Operations Center, and thanks again for supporting us moving over into the David Braley Center. We have a state-of-the-art Public Health Operations Center, as do all the departments and divisions across the city have their own department operations centers that are up and ready. And Hamilton Health Sector Committee, which is made up of various partners, including the CCAC, primary care, Hamilton Public Health, the hospitals. We also have been meeting and are prepared and set for anything that might come our way. So all of this demonstrates both collective ownership internally in the city, but also collective ownership externally. And in addition, in terms of our state of readiness, Pan Am 2015, that's our provincial lead, and we've been interacting with them for the last 2 years, Public Health, and along with Public Health Ontario and the Ministry of Health. The Hamilton Municipal Command Center, and we'll talk about that in a little bit more detail, the Hamilton EOC, and the Public Health Department Operations Center. As I indicated, all of this will be set and ready. The key preparations that we have in public health, which is of interest to you as Board of Health, is we have response plans that are based on the health impact risks, both locally and provincially. We're focused on infectious diseases, and we've been interacting with the Public Health Ontario on that and the local health sector. Food is, we've been doing ongoing inspections under the leadership of Richard McDonald, and the Director, Rob Hall, has been overseeing that. And similarly, in terms of being prepared for heat response, Matt Lawson is the manager there, and he's been again being led by Rob Hall. And there's a harmonized heat response or harmonized warnings that have been created in preparation for Pan Am, so that no matter where you are in the Pan Am footprint, when we're talking about what the warning levels are, they'll be all the same. And you need to tip your hat here in the City of Hamilton, because the warning stratification that has been adopted for that harmonization is largely, if not completely, based on what was developed here around the council table some years ago. So congratulations on that work. And you also received in May Community and Emergency Services report about the heat response. So this is different than the alerts, but the heat response, so that's well up to date and ready to be implemented if heat is an issue during the games. During the games itself, in terms of our enhanced activities, food inspections will be increased. We have increased communications, and the increased communications has to do with food surveillance. So on a daily basis, food surveillance will be interacting with Public Health Ontario, the Ministry of Health. Some of that's already ongoing, so there's advanced surveillance around from all the countries that are coming to the City of Hamilton. Hamilton's Municipal Command Center is up and running. The Ministry of Health and Long-Term Care, Public Health in Ontario, all of those are actively engaged. The resource implications during the game, public health staffing, public health emergency response structure has been postponed, or vacations are postponed between July 10th to the 26th. Food safety has postponed vacations in June and July, and other teams have restricted vacation during June and July. And all of that has been on a voluntary basis of all the staff at all levels. So I think we all owe some gratitude to the public health staff who has made those types of sacrifices for themselves and their families in the interest of public safety. And for me, it's been an honor to be part of this public health team in that regard. In terms of finances, any finances that we might occur, we're tracking those. They'd be submitted to Pan Am 2015, the Ministry of Health, for reimbursement and consideration. But I should also mention, again, in terms of the contribution to Rob Hall's team and many others, the food inspections, for example, were increased, and they currently have been increased right now, so that during Pan Am, we don't have to, it's less likely that we'd incur any financial costs in terms of extra staffing unless there's some untoward events that weren't expected during this event, which would potentially happen regardless during any summer. Demonstrating for you what is the boxes that are in yellow is what's the most relevant for you here locally, and the municipal EOC, which all of you as Board of Health would have potential to be interacting with, the Department Operations Centers, and then we have the Health Sector EOC. You'd be getting information as elected officials from these various local units, and the Municipal Command Center is the means by one point of contact where we'll be collecting information provincially, locally, and making that available to council as required if it's necessary, and similarly to the city manager, so that at any point in time, 24 hours a day, if you need some information, we've got it organized locally and provincially in order to provide that to you. I mentioned the Municipal Command Center. You might be wondering what that is. That would be three people, myself, or three primary people, myself, Coralie Secor, and Greg Maychuk. Coralie Secor, as you know, has been leading the Pan Am. She's doing a spectacular job with the assistance of Greg Maychuk. My role is just to show up on July 10th to the 26th, spend about 16 hours a day in the Operations Center, go home, have a nap, and come back, and be available to coordinate the communications. What this function is to coordinate that communications, as I said, a point of contact locally so that we are coordinated across all the departments and divisions in the city, and so we act locally, but we communicate provincially. So this is what the Municipal Command Center looks like. It's in the middle, and those are all the departments and divisions that are meeting at 10 o'clock every day, either virtually or on site, so that we have that coordinated effort on your behalf, so that this is just one great experience for the city and seems seamless to all the residents and to yourself, that we're providing an efficient service. And then you can see that we're interacting with the province again, so that there's a coordinated response with Pan Am 2015, and the Board of Health would have opportunity through the Public Health, because Public Health is part of this Municipal Command Center organization. So, subject to any questions that you have, that would be this is what we've covered. We've covered the event information, the risks, the supports, and public health and the city's readiness for Pan Am. Some of the legacy components that I should mention is, of course, we're looking to leverage, public health is looking to leverage on healthy communities and promoting the notion of physical activity. We're looking for excellence in communications, and we've illustrated here for you today that there's many communication links that have been developed and enhanced with the provincial government, Public Health Ontario, which will be of help for you as a Board of Health on the way forward. We've created, with our partners in the provincial government, health dashboards, so that, and this is also going to be a legacy component, so that we'll be able to provide you with timely information 24 hours a day on many different health aspects that was not previously available. Heat alerts, as I mentioned earlier, harmonized based on some great work around this table, and that is expected also to be a legacy. And all of this, at the end of the day, it's It amounts to a great team with great support from you, and Pan Am is going to be one great experience. Thanks.
Thank you, Brent. Crisp and factual and direct presentation as always from you. Thank you very much. Councillor Ferguson, you had some questions.
Yeah, just a comment. I think we should all feel very comfortable that we're ready to go. Regularly, monthly here, updates from Corley, as Brent said, is leading us along with Greg Maychuk and Shelley. And I know the Pan Am Torch is coming into Ancaster at 3 o'clock on Sunday, so we're about to get underway. As you know, Mr. Mayor, we've heard from the lead commander in the police that they've been rehearsing and preparing for months now. And should some soccer fans misbehave or some people looking for trouble, we're ready to deal with that. And now we hear from public health that they've been working hard and have a plan in place, suspended vacation, the same as police, to make sure that we're properly staffed. So as chairman of the Pan Am subcommittee, I'm very, very pleased with the way everyone's responded to this to make us proud when the Pan Am Games are here through the month.
Thank you. Thanks, Brent. Councillor Whitehead.
And we're very happy that the torch run is going through Waterdown, Ancaster, downtown. Very, very, very happy. And Mountain would have been a nice stop. Said that.
We'll divert them for you.
Yeah. The question I have is, what is our tie-in? I know there's always been concern about travelers internationally, and you usually follow, not us, but it'd be the federal government. So I guess, what is our connectivity with appropriate departments of the federal government in regards to concerns of outbreaks in other areas that might be Pan Am Games?
Yeah, through the chair to the councillor, I'll start the answer, and Dr. Hopkins may want to add to that. In terms of the Pan Am planning, Public Health Ontario has been the lead around surveillance, and the surveillance is being done by Public Health Ontario with the support of this public health unit and all the other public health services that are in the footprint. That surveillance is international surveillance. That's work that this public health service does on a daily basis, and but it's been augmented by a much more coordinated response currently.
Right. So we're aware if there's outbreaks in any of the participating countries in regards to travel to Ontario.
We're going to go to the good doctor over here.
Yeah, through the mayor, thank you for the question. So yes, there are well-established communication channels that exist, and we get regular updates from the federal government via the province that will let us know of any concerns that are happening in other countries, and we're vice versa sending information on a local level back to the province, and that will go federally as well throughout the games. This does happen on a routine basis, but we will be extra mindful during the games because we know there's an increased number of travelers during that time.
Appreciate it. That's the only question I have. Thank you.
Thank you.
Thank you. Any further questions? Yeah, we're all looking forward to great games, Brent and staff, and I can reiterate what Councillor Ferguson said. I think our staff globally have done a spectacular job of getting us ready for this, and I think all we need to do is just fulfill, and that's what we're all here to do, and make sure that folks that come here are going to have a brilliant time. So thank you for all your great work and the
Thank
staff.
You.
And
we'll see you at the games.
Sorry?
We'll see you at the games.
Yep. And you'll be wearing that lovely blue suit while you're there. Eye candy at the games. Motion to receive the report. Moved by Ferguson, seconded by Pearson. All in favor? Carried. Thank you. Thank you, Brent. Next item is the food strategy, item 8.1. Update. Will there be a presentation, I believe, or at least a brief overview?
Through the mayor, there is no presentation, but I would look to Dr. Tran to provide a brief introduction.
Okay, Dr. Tran.
Thank you. Through you, Mr. Chair. This information report is really an update in terms of the community consultation process in developing the food strategy, which we're hoping to present to Council for an endorsement early in 2016. So in the report, we provided a fair amount of detail in terms of where we're at in terms of the community consultation process, a significant number of progress and updates of actions and policies that's been done cross-departmentally that relate to the food strategy and proposed next steps. And feel free to ask me any questions about it.
And we have some questions coming from Councillor Collins. Councillor Collins.
Mr. Mayor, really no questions at this point in time. I did want to thank Dr. Tran and his staff, Claire Lechner, as well as Ruby Samra, who've helped the East Hamilton Food Bank Committee that's seeking to establish not just a food bank, but a food center. And if you look on Appendix B, as part of the report, under the proposed food strategy goals, it talks about phasing out food banks and the introduction of food centers across our community. And as you very well know, having formerly represented the area as a councillor as well, Riverdale is a welcoming community to many new immigrants, and the group that I'm working with is anxious to see a food center rather than a food bank. And I'll have a motion before Public Health, I believe, in July, seeking some funding through our area rating resources to assist with that initiative. And I didn't want to let today's report pass without thanking Dr. Tran, Claire, and Ruby for their assistance over the last several months with that initiative. So
Good.
I'd be happy to move the report.
Okay, thank you. I'll come back to you on that. Councillor Whitehead.
Yeah, I mean, that's just great programming, and it's a transition that's taken place. I know Neighbor to Neighbor just received a significant, I think it's about $1 million or something for their food center that they're developing at the former CACC property in the Rolston neighborhood, which is a code red neighborhood that we're doing neighborhood development in. The concept is absolutely incredible, and there's funding and there are partners. There may not be enough funding on the capital side, so I may be coming forward at some point in time to further flush that out and see what we can do as a city to assist it. But it is the new way of approaching things. So it's not just about handing food. It's about community. It's about kitchen and preparation and etc. So there's no stigma to it because it really is a community effort. And providing the tools to the community that may be lacking some of those tools in regards to education, camaraderie, and certainly dignity. So I look forward to working with Neighbor to Neighbor, and I can certainly appreciate why Riverdale would be excited about taking a very similar approach. Thank you.
Thank you. Dr. Tran, anything to add to that?
Through you, Mr. Chair, happy to also follow with Councillor Whitehead. We've been having some good discussions and partnerships with Neighbor to Neighbor about how do we help support the Community Food Center, which is a very exciting initiative. And I think it's one of those learnings that we brought when we met with Councillor Collins about how we move forward similar types of models and learnings across the city.
Very good. Thank you. Any further questions? Seeing not, could I have a motion to receive item 8.1, moved by Mr. Green, seconded by Councillor. I'm having one of those moments. Fire. Oh, Chad. Chad did move it. Yeah. Chad moved by Chad, seconded by Councillor Green. All in favor? Carried. Thank you. Item 8.2, trends and responses to those dirty rats in Hamilton. Rob Hall, by chance, or who's? One sec.
Through the Mayor, there's no presentation associated with this report. However,
Okay.
Mr. Hall can introduce the report.
Okay, so we'll, Rob, do you want to just give a brief overview? And
Sure. Thank you. Through you, Mr. Chairman. Yeah, back a while ago, Council gave Public Health Services an enhancement per 4.5 of an FTE because we had identified that there was an increasing trend in rats and, associated pest infestations in the city. So thanks to the enhancement, which we can announce, we successfully hired another part-time health inspector to work on. We wanted to bring back this report to try and pull together as much information as we can specific to Hamilton and what's going on in our city. And as you see in the report, there's really no area that's not affected by rats. Rats are ubiquitous. They are, part of an urban center. I think the only ward that we have not had a complaint in is Ward 14. And I know that the councillor is very proud of that. No rats out there. But I think the issue that we're trying to deal with is one of enforcement is really only a component of education, and so that's part of the recommendations that we put forward, is to develop more resources for the homeowner and the public, because you can't tackle this on a one-on-one basis. This has to be a community effort. So when we have an infestation in a neighborhood, we go door to door to a number of homes to try and help educate the public about what they can do to protect their property, and we're going to develop more resources. We're going to work more closely with MLE on property standards inspections, because we know that if there's debris and other materials in a yard, those are the types of harborages that we can have an effect on. So through this report, we've identified some positive steps we're going to take. There's no financial implications at this time, and we hope that cyclically and seasonally, hopefully we won't see a trend continue, but we really need to get out there and work in a cooperative manner with neighborhoods when we identify that there's issues or when they make complaints to us. So thank you.
Okay, thank you, Rob. And I've got Councillors Green, Jackson, Duval, and now Pearson. Did I miss anybody? Nope. Okay. Councillor Green.
Thank you very much, Mr. Mayor. Certainly, anecdotally, when I went through the community last year, I heard the personal stories of this, and I know statistically it tells one story, but when you find out the kind of impact that it has on people, you can think of the news article with the young child there who had been bitten. I'm very happy to see us move in a direction that's more proactive, and I'm just curious about the trends, because we're trending upward here, a massive jump from 13 to 14, and I guess we're ahead of the pace here on 2015. So although I've read, and I could have missed the number, what is the projected number of incidents or complaints that we're anticipating for this year?
Rob?
Through you, Mr. Chairman, based on the number of complaints we've received to date, I can give you just a mathematical projection, but it's really based on the responses or the issues we get from the public. So if people start taking care of their properties and they don't call us, then we don't have the data to be able to extrapolate this out with. Are we going to trend upward? We probably will continue trending for a while. But if we start putting in place more proactive communication and proactive responses in the neighborhoods, hopefully over the next couple years, we'll see that trend start to decline.
Councillor Green, sorry.
That's okay. Collins? It's good. No, it's a brother from another mother.
I think.
So on that point, I certainly appreciate the increased FTEs. I see there, although we're talking about a distribution perhaps across the city, based on the dots, I'm seeing a lot of there, looking familiar in my neighborhood, Mr. Mayor. I just want to make the statement now on the record that I'm happy to partner with staff on the PSA, the public service announcements, any of the social media campaign, anything at all that I can deal or assist with in terms of getting that information out, because I think it is critical. We've been seeing the neighborhood action strategies and all those types of things come to unfold in our neighborhood. So I just want to say that I fully support this initiative and certainly hope to help support them with the public service announcements. Having said that, I'm hopeful that we are investing in, I see the baited program there with the sewers. I'm hoping that we're being aggressive on this. I don't want this to turn into an epidemic. We've seen what's happened with bed bugs. I'm hopeful that this upward trend plateaus quickly and we get back into a better position in our neighborhoods, because I would say that there is a certain concentration of these instances.
Okay, thank you. Take that as an editorial comment as opposed to a question.
For the record, it was a strong statement of support for our staff. Gotcha. And an offer to help with an editorial comment at the end. Thank you.
Thank you very much. Thanks for that clarification. Councillor Jackson.
Thanks, Mr. Mayor. Appreciate Director Hall and his staff, this more proactive move. Rob, you talked vaguely in the report about causes for this, because until we truly know a specific cause, Mr. Mayor, on anything we do in life, it's hard to get at the root of the problem and to get solutions. You've talked about weather change, sometimes some flooding has occurred, and things like that, but are we different from your counterparts that you're aware of in other cities? Is there some reason Hamilton? Is it something we're all experiencing? You get the gist of what I'm asking, Rob. Mr. Mayor, through you, please.
Through you, Mr. Chairman. We're no different than any other large urban center. Each one of them has rats. I think the issue that we're finding is that in Hamilton, we don't have one or two causes. I think it's accumulation of various factors. And those could be the issues with weather. It could be the issues with some construction. It could be the issues with displacement of animals, these rodents, and the availability of food. The major factor we find with rodent infestation or rat infestation is that if you have water, food, and shelter, they will come to you and they will find a place to live. And so those are the main three things that we need people to be aware of around their properties to protect. If we identify a major infestation in an area, then we have the tools under the pest bylaw and under the property standards bylaw to try and remediate those cases. But until we find out about them, we're just sort of asking people to be diligent and then contact us and we'll do the investigations.
Thanks, Rob. On page 3 of your report, Rob, at the top, you talk about what you'll continue to do to investigate and respond, and you just touched on a few of those. I guess, Rob, I want to make sure, and Rob, without stigmatizing or naming an area, there was one, as you recall, the last 2 or 3 summers, seemed like a consistent area in my ward off of one main artery in one main arterial road, and with several homeowners in the backyards that abutted that main arterial road, if it's coming back to you now without naming the district, Mr. Mayor. At first we thought it was the homeowners, Mr. Mayor, and again, what you just said, Rob, about let's teach them what not to do, and that will attract. And then we found out, if memory serves me right, Rob, with your records and files, that it were actually emanating from the main arterial road for whatever reason, and then you got into doing some sewer baiting. But it took a little while to reach that point. So I guess, Mr. Mayor, I don't mind the educational. I just don't want to get to a point, if somebody's living like a Sanford and Son type of situation, that's different. Absolutely. Bring property standards down, whatever. But short of that, I just want to make sure public health isn't just handing off some flyers. Be better, Mr. and Mrs. Homeowner, and if not, we're going to bring the property standards bylaw down upon you, and then discover beyond the homeowner's property, the problem was actually emanating from a larger general area. So, Mr. Mayor, through to Director Hall for a comment on that, please, Rob.
Through you, Mr. Chairman. Yes, sometimes these investigations start off with a few calls and then they start expanding out. So you start circling out from a complaint location and you start discovering that there's other areas as you go out. I think the key point here is that it's not just one type of action that people need to take. It's an integrated pest management strategy that requires cooperation from everybody, which includes homeowners, taking the right answers, us being able to identify those areas where possible sources of the rodent infestation and taking action against them, and spreading out sort of in a concentric circles, looking for those places where they may be coming from. But you'll notice that it does take, there was a big fly. It does take time for these investigations.
I don't think. Yeah.
It does take time for these investigations to come forward. The main point, I think, is that by trying to get more people involved in an integrated pest management program in their neighborhoods, not just around their houses, but through their neighborhoods, we'll be able to take more action and be able to resolve these hopefully quicker. And do exactly what you're saying, is not just look to label one area or one problem as a solution.
Councillor Jackson.
So I'm encouraged by that, Mr. Mayor. I just want to make sure public health wasn't abandoning once they handed out some leaflets, that they're there proactively available, as Rob and his staff have always been, at least for my community. Thanks, Mr. Mayor.
Thank you. Councillor Duvall.
Thanks, Mr. Mayor. Through you to Rob. Rob, when I look on page 5 of 10, the graphs that you have, and I look at 2012, 2013, 2014. So a lot of the calls, you look at downtown, and then they increased 2013. And if you look at Ward 7, we started in there's 4 calls in Ward 7 in 2012, 6 calls, I guess, in 2013, and then 16 calls in 2014. So if you look at from 2012 to 2014, a lot of them were downtown, and now seems to migrate it up to the mountain. What is happening? I mean, obviously we don't get no calls, and then now we get all these calls. And I look in Ward 7, some of them, during the 3 years, you've got circled in the same spots. So it's like a continuous basis of a complaint. Are we doing anything to, in those certain areas?
Rob?
Through you, Mr. Chairman, I think you're going to find that when on the mountain, there's been a lot of activity, a lot of types of actions. I think people on the mountain are becoming much more aware also. So we're getting more calls. I can't tell you whether or not there's actually more rats now on the mountain than there was before. I think we're getting more calls, which means that people are more aware, or they're seeing them. That in itself tells you that the rats may be present in the previous years, but now they're looking for food, they're looking for shelter, they're looking for that water that they need to sustain themselves, and so they're coming. I dare to say it, they're coming above ground to start making themselves present. Is there a problem that's explicit to that neighborhood? We don't know that, and we don't have any data to support it. But if somebody was to call, or if neighbors are to call and say, we think we have an infestation in our neighborhood, we'll go down with our staff and we'll look around and we'll try to identify it. But as far as one ward trending, I don't think there's any evidence to say that there's a specific trend in that ward, other than maybe more people are aware and calling now.
Councillor Duval.
Okay. So my other question to you, Rob, is have we looked at the areas circled? Are they near areas of restaurants, business type of owners, when they have the big green bins and they're not shutting them, or they just got food extras all around? Notice anything of that?
So through you, Mr. Chairman, restaurant inspections are always, one of the components of restaurant inspections is to look at the garbage and the way it's handled. I think the key is that if there's food at a restaurant that's being mishandled, it's the restaurant that gets the infestation. The rats will go to that area to try and find that food. So what we can do is when our staff are out doing the restaurant inspections, we can look around the area where the restaurant is to see if there's any harborage. But we're not getting any more complaints next to restaurants than we are any other places. We just don't have the evidence to say that restaurants are the actual source of these types of complaints.
Okay, and my last question is, Rob, do we work with our actual bylaw people looking for these areas and the complaints of the excess garbage on a continuous basis? There's all kinds of little back of strip malls where we constantly get the complaints. Are we working with bylaw and the public health to look at those areas?
Yeah, through you, Mr. Chairman, that's the recommendation was that we need to continue to make this a priority between municipal law enforcement and public health, so that when we get these complaints and our staff are out doing the complaint investigation, they contact MLE right away, because we're both looking for those areas that could be harborage for rats. And they have the means under the property standards bylaw, and we have the means under the section of property standards with pest when there's an infestation to take action. So working together, we get rid of the harborage and we have the means to get rid of the rats on properties where it's identified.
Okay. Thanks, Mr. Mayor. Appreciate it.
Okay, thank you. Councillor Pearson.
Thank you, Mr. Mayor, and certainly appreciate all the information. And I've been very fortunate in Ward 10. We haven't had a lot of rat complaints over the years, and usually they start up with regards to compost piles in backyards which aren't being correctly taken care of. So I'm through you, Mr. Mayor, I'm assuming this is the education process. Like I'm trying to tell residents, that's why you have a green cart. You don't put your leftover chicken bones or your egg shells. Those are what attract mice and rats in composts in the backyard. Is that correct to Mr. Hull?
Through you, Mr. Chairman, any kind of food source will attract, rodents, whether it's mice or rats. I think part of the campaign is to try and alert people to proper storage of any type of food product, whether it's green bin wastes or if it's backyard composting. There is proper ways to do that so that you ensure that there is no what you would call access to rodents and pests. So definitely, we'll work with, we want to work with pest control, Public Works, to make sure that, people that are doing those types of backyard composting are doing it correctly.
And the other, Mr. Mayor, is also with regards to, and I just got an email now of a resident advising me just a block away from me that some elderly people are taking it upon themselves of feeding stray cats in the neighborhood. So that means food sources being put outside and left outside, so that'd be water and cat food, which is another source. And, for the viewing public, they need to know that you shouldn't be doing this. And the other is, over the years, I've had the problems with a multitude of bird feeders where they put out a large number of them. So maybe Mr. Mayor, Mr. Hall can elaborate.
Through you, Mr. Chairman, yeah, definitely. People want to do what they think is the right thing, but in the end, sometimes that right thing causes other problems. So, allowing even dog food or cat food to be put out back will be a source of food that will draw rodents to your backyard. Bird feeders have always been traditionally a problem. Because of the nature of the bird feed, and it's an available source for the rodents to come to. So people need to be very, very careful in how they do it, and the ways in which they're putting food out, any food, because if in the past, in some urban areas, you do have issues not only with rodents like rats and mice, but then they start attracting skunks and raccoons and various other animals that you don't want in your yards.
Right. Thank you. And my last just question is, you mentioned on page 3 of 10 of the report requesting local sewer baiting by Public Works. Do we have an idea of what, and if that program would go forward, what it would be like and where it would be implemented? Through you, Mr. Mayor.
Through you, Mr. Mayor, could you repeat that?
Yeah, it's the requesting local sewer baiting by Public Works.
Through you, Mr. Mayor, that's when we identify that we have a complaint and we're investigating it in an area. So when we start doing the investigation, we'll contact Public Works and tell them that we've had rats identified in the area and that we would like that sewer area baited. They have their own licensed contractors who will go out and distribute the licensed product safely within the sewers. The length and the area of that is up to Public Works and how they try to do that based on the sewer configuration.
Okay, so who would the contact person for that be, Mr. Hall? Would it be yourself?
Through the contact center.
Okay.
If people make complaints about rats, they'll come to Public Health, and then we will do the referral on to Public Works.
Okay, thank you very much. Thank you, Mr. Mayor.
Thank you. I've got a wily raccoon in my backyard often, and he's defeated my bungee cord on my green card. He's figured it out. I'm going to have to come up with a different system, but they're clever little creatures. Councillor Connolly.
Well, thank you. In your report on page 2 of 10, through the mayor, you talk about the number of instances we've had this year, 24 as of April 30th, where last year we had 6 through the same time. So are we suggesting there's a 4 times increase in the station now?
Through you, Mr. Mayor, I think the data indicates that people are much more aware and are looking out and seeing more rats now. Now, whether I can extrapolate that into saying that by the end of the year we will have 4 times the amount of data, it might be likely, but at this point, the purpose of it was to show that the data that has been increasing over the last few years is still trending up, and that those trends we need to get on top of and start taking action. But it's not going to happen overnight. We're not going to see an abrupt stop in those in the number of calls we get. In fact, we probably will see an increase in calls based on today's report and information going out into the public through the media about this issue.
And next question. Would you say there's major infestation in any area of the city right now? Major infestation?
Through you, Mr. Mayor, no, I don't think there's a major infestation through any area. I think there's neighborhoods that have issues that if we are alerted about, we'll investigate and, we can take care of through the communication and the baiting and those various things. But I couldn't tell you whether or not there's an area that has a major infestation that we should be concentrating on right now because, rats are everywhere. It's a question of whether or not they have the food sources, the water, and the harborage in place, and whether they get displaced from that.
Other questions for the mayor? is there any relationship from last year to this year going on that certain areas get more rats than other areas? I mean, is it traditionally Ward X has 60% of the rat situation and Ward Y doesn't? Is there any data that would indicate that?
I think, through you, Mr. Mayor, I think there's, if you look at the maps, you'll see that we do have a concentration of complaints related to rats in certain areas, and that could be because of density issues. That could be because of the number of close buildings. But there's really, I hesitate to say that there's a rat area in Hamilton that's of a higher intensity than anywhere else, because I think rats are present everywhere. The question is whether or not they have the ability to find the food, water, and shelter they need, and that's when they start to become visible above the sewers and outside of their normal harbораges areas. But I think if you look at the maps, it shows that there is certain areas that we probably get more calls from.
And proactively, if we have areas that seem to get more, do we proactively do more in that area, either education or the sewer, whatever you put in the sewers, proactively, or do we wait until we have the problem and then deal with it?
Through you, Mr. Mayor, the proactive side is difficult because when you talk about areas, sometimes an area is only 5 or 6 houses in a cul-de-sac versus a large area where there's 30 or 40 or 50 homes. And so to be proactive, we haven't actually had any trends where every year we're going back to the same neighborhood. What we're finding is that once people become aware and educated about what they can do, they protect themselves, and then the rats suddenly don't start wanting to come to their properties because there's really no food sources or shelter or water.
Thank you, Mr. Mayor.
Okay, thank you. Rob, so just to be clear though, so define infestation. I mean, I don't think you're saying in this report that there's an infestation anywhere. You mentioned it once in the report. What is infestation defined as?
Through you, I think if you want to get into clinical terms, an infestation would be anything more than one animal. But a house can be infested with a rat. A house can be infested with a mouse. An infestation basically means that you have some critter living there or it has been taken up residence in that area. Right. So it's not about the number. It's more about the fact that you actually have one of these rodents in and around your area.
Right. So it doesn't denote a certain volume of, or it becomes an infestation. One will do it.
Through you, yes.
Okay. That's good. I think that's important to clear up, I think. Okay, thank you. On that item then, can I have a motion to approve? There's a couple of recommendations. Moved by Pearson, seconded by Vanderbeek. All in favor? Carried. Thank you. Any discussions on item 8.2? We've done that. 8.2. Sorry, on item 8.2, that was 8.2. Added item 11.1 and 2. Okay, 1 second here. So, are there any motions? No further motions. Notices of motion. None of that. There's some general information on item 11.1. The recommendation is it be received. Moved by Pearson, second by Conley. All in favor? Carried. And there's an added item 11.2, which is the Ministry of Health Long-Term Care Memorandum. Move it. Moved by Pearson, seconded by Farr. All in favor? Question? Councillor Green.
Just on that point, I saw that extended dental program on 11.2 there, and I think that it's important for us to note just how many people go without dental care in our city. I can say myself, I'll be very honest with everybody, up until having this job, I wasn't covered. And so I can only imagine for folks that are living below the poverty line, especially with families and young kids, you see some of the lack of care there. So I'm very encouraged by this. I'm hopeful that we can do the best we can to make sure the community knows about it so that they can access this program and get that dental care, because it is such a huge thing for people, especially the kids, to get a handle of that early in life. Otherwise, they say, and I'm sure the doctors can back me up on this, that the oral hygiene is often an indicator of overall health. So to take care of this, for me, is a very important issue for Ward 3, and I'm happy to see it come to our table.
You, Dr. Tran, did you want to add anything to that? We did make some changes in terms of funding that we added to the dental care plan.
Sure. Through you, Mr. Chair, I would agree with Councillor Green that oral health is not only an indicator, but it is an important part of the general physical health, and taking care of oral health will lead to other benefits other than oral health itself. In terms of this overall program and integration, we've been working or keeping ourselves very well informed, participating in teleconferences to make sure that when the province does fully take over or upload this program essentially, that we ensure that people aren't, and children and youth aren't being left behind, that we're ensuring that there's appropriate thresholds, appropriate preventive services, and done in a way that that it ensures not only the same level of service, but ideally even better service than we're currently providing. We did provide a report a number of months ago looking at utilizing the municipal share that was dedicated towards this type of program, that when it is uploaded, that we would redirect it towards a seniors or a health program, and we still intend to do that. There has been some details that we need to sort out with the province. They had initially planned on fully uploading and centralizing the program as of August 1st. That has been, to our knowledge, delayed until the new year. However, they're having discussions with us in terms of because they've only asked us to allocate 7/12 of the budget, that we would still find ways to have the provincially funded part so that we can hopefully implement our seniors program this fall.
Very good. Thank you. Councillor Green? Yep. Good. Great. Thank you. It's been moved and seconded. All in favor? Carried. Any private confidential? There isn't any. A motion to adjourn. Moved by Connolly, seconded by Pearson. All in favor? Thank you all very much for your time and attention and good work.